Hello again. Our Medicare Moment topic for today is on what to do if you are Medicare eligible and faced with losing employer coverage. My name is Fanny Pacheco and I am joined by Kim Caldwell. We are both managing partners at our agency, PBI Insurance, where we specialize in providing healthcare solutions to seniors.
So for about the last 15 years, we've seen a trend where more and more employees have been pushing off retirement and working well into their 70s, even 80s. And what this has done is caused a special niche for Fanny and I to partner with companies and employees to help, human resources departments and the individual employee navigate what their Medicare rights and options are. Unfortunately, however, over the past few months, what we've seen in terms of employers is an increase in layoffs. Not only are these employees faced with being unemployed, but they're also faced with making decisions about their medical coverage going forward. So our specific expertise is helping those employees who are being laid off and who are Medicare eligible. And one of the things we say this with, whether it's a layoff or retirement or, just making a decision, moving from a group plan to Medicare is not always a quick and easy process. In general, Medicare really requires a serious amount of effort and uncovering to fully understand the different, the nuances of it. And then on top of that, when you talk about a layoff situation, it's not just the individual Medicare eligible employee who's impacted, but potentially their spouse and or dependents. And then they're wondering how they're going to be covered going forward. So, and I want to digress a little bit. We say this time and time again. In these types of urgent situations, a lot of times people reach out to friends and family for advice. And the problem with that is that people are not going through the same situation as you. And so essentially when you get their advice, you're only getting their perspective. The other perspective that oftentimes a person in this situation goes after is to call their group insurance carrier. So whether that's Blue Shield or Health Net. And the problem is that when you're talking to them about Medicare, you're only seeing their Medicare insurance products, and those Medicare insurance products might not be in your best interests. So what we advise is that an employee in this situation needs to get consultative, unbiased assistance to walk through all of the potential options that someone has.
When someone is laid off, they are clearly put in an urgent situation where the tendency is to speed up the process and just get coverage. We're here to tell you that, again, with Medicare, how and when you make decisions will impact you in the future, and whether and how you try to change your plan later on. So again, your early Medicare decisions can have serious consequences. Some of the questions that we often have from our potential clients, we often have clients call and ask, can you sign me up for a Medicare Part C plan? And so we always have to backtrack and ask the client, well, do you have Part A? Do you have Part B? What coverage do you currently have, if you have any? Are you currently covering your spouse, your dependents? Because what will happen to them when you go on Medicare and they are not your dependents anymore? And then what Part C plans are available in your area? We oftentimes speak with potential clients who call us and they are sold on a particular Part C plan that was recommended by their cousin up north, but they live in Southern California and that plan is not available in Southern California. So again, Part C plans that are available in your area are really vary. And then a huge one is medications. Are your medications covered? You have to ascertain that your medications are covered in the Part C plan that you sign up for. And then also very important, your providers. Does your provider accept every Part C plan available in your county, or does he or she only accept 2? These are very important questions that we will ask. And the reason why we ask is to bring them to the forefront and so that you understand that all this affects your decision on a Part C plan.
So the other really, urgent inquiry or question we get is, I just lost my job and I need coverage ASAP. Can you help? And we can, but timing is everything. And you're going to hear that a little bit throughout the rest of this presentation. The question is, how soon do you need coverage? In order to process Medicare Part A and B through the government, you really need a minimum of 4 weeks, and that's the minimum. This is, and as things have been unraveling in terms of COVID, we've sometimes seen that stretch longer. So we can get it done within 4 weeks, but it requires a rigorous conversation. So we do need to work pretty quickly about getting all this processed. And then the conversation also needs to go on and start talking about, do you need Part C, like Fanny mentioned before, or a Medicare supplement plus a prescription Part D? And that again is that rigorous conversation about what meets your needs, which option actually fits you the best. But I will tell you, no matter what, making sure that there isn't a lapse in coverage is our number one priority, to help you make sure that there isn't that lapse of coverage. But there are cases where acting too fast can mean making a bad decision. Again, Fanny mentioned this, that does have lasting consequences.
And probably as of late, the number one inquiry has been with regards to COBRA. And COBRA is there to help those who are, experiencing untimely and, last minute loss of employer coverage. And yes, COBRA is there, it's available for you, but there are different rules that apply to those that are Medicare eligible over 65 when enrolling in COBRA. And so, oftentimes, we again meet potential clients who feel like, well, there's no rush. Maybe we can speak next week because I'm going to sign up for COBRA. But if you are Medicare eligible over 65 and on COBRA, you actually do have to sign up for Part B. It affects how your claims will be paid. It affects your COBRA coverage. And it's very important that you understand how COBRA works for you after you're Medicare eligible. So what we did is we have a list of questions here that, as a rule of thumb, we always ask our clients. And again, we ask this to help determine what the best coverage will be for you, or just to help you understand how to choose your coverage. And so part of it is, our first one here is Medicare or employer plan primary. So the size of your employer, the size of your employer matters. It helps determine whether signing up for Part B is mandatory or signing up for Part B is optional. Again, spouse or dependents, whether your dependents are age 25 and about to age out, or your dependents are age 15 and they will need ongoing coverage for a few more years. Again, prescriptions, a huge one, often a deal breaker. Every plan covers prescriptions differently, so we have to make sure that your prescriptions are covered and that you have the best coverage or the most comprehensive coverage that is available to you. And then, we have here comparison for employer plan versus Medicare. So even if you are not being faced with losing your employer coverage, if you are 65, if you are Medicare eligible, we strongly recommend that you compare your employer plan to the Medicare plans that are available to you, because we have found that, I've had a couple clients be in awe once I've done this comparison and have discovered that some of the Medicare options out there are a lot more cost effective to them. So we compare your current plan benefits and the coverage costs. And again, we compare it against your Part B, Part D cost, and then we help you make the decision. Well, we help educate you, explain the plans, and then ultimately you make the decision. But as of late, we have found a lot of clients who have been very surprised to know that there are great comprehensive Medicare plans available to them.
So whether you're retiring, being laid off, or just deciding to go on to Medicare, timing is everything. Not only do we want to make sure you don't have a lapse in coverage, but we also don't want you to be paying for your group plan, if you pay anything for your group plan, your employer plan, and Medicare at the same time. So timing is everything. So we want to make sure that we know that if you're working past age 65, you're going to fall in, one of three categories. One, you're 65 and you're working and you've got no, immediate plans of leaving your group. The reality is that you should still know what your options are. As a Medicare eligible employee, you should want to know what your Medicare options are. and realize that if you are working over 65, that you can make the choice to go to Medicare at any time. You don't have to wait for your employer open enrollment. You don't have to wait for any special enrollment. You are eligible for Medicare at any time after age 65. So you have time. You can absolutely talk to an agent and get some good information. If you're retiring, hopefully if you're retiring, you have some time. You know that you're going to retire in a few months. 2 to 3 months before you're retiring, make sure you have that conversation, because again, from a timing standpoint, we can make sure that you're not going to have a lapse in coverage after you're retired. And then in the urgent situation, from a layoff standpoint or losing employer coverage for whatever reason, the rule of thumb goes back to the original one. If you're 65 and Medicare eligible and working, these are unforeseen circumstances. So if at age 65 you'd had the conversation, that you had an agent in your back pocket that you are getting counsel from, those rigorous conversations could have been done prior to the layoff situation. So obviously not everyone that's looking and seeing this is in the situation where, you know, they have imminent layoffs or imminent about losing employer coverage. But if you're 65, you should be talking to somebody and have an agent in your pocket that knows your circumstances, knows your situations. So that's pretty much the bottom line. I kind of reiterated that, but that's really what you want to do is as you turn and become Medicare eligible, you want to talk to somebody about what your options are, even if you are staying on your group coverage for the foreseeable future.
Is on the screen, and I do want to mention that so this video will go out to all of our current clients. And another question that I've had a lot actually last week is whether we are only available to you because we were referred to you by your employer or your HR department. And so the answer is no, we are available. We are happy to help anyone who is over 65 and really needs our assistance. So please do feel free to share this video with your friends and family. And again, you know, we are happy to help. Again, we do specialize in those who are Medicare eligible. So as you know, as much as we wish we could help everyone, unfortunately we can't. But if you're Medicare eligible over 65, we can definitely help out. So feel free to share our video. Thank you for watching.